For our next session, I would like to invite Dr. Saravanan S. Sundramurthy, the head of Health Performance Unit, National Institutes of Health NIH, to talk about measuring trauma system performance. We welcome him on stage.
Very good afternoon. I hope, I know everybody is hungry. I hope that you can give me at least about 20 to 25 minutes of sana. Kena tembak sana lah. So you have to give me at least about 20-25 minutes full concentration. Hopefully you all can just hold yourself and hopefully you can see me lah, rather than looking at the computer, if you don't mind. First of all, I would like to thank you very much to the chairman of Trauma Registry, Dr. Shahjahan Muhammad Yusof, who's given the opportunity to my unit to come and give some briefing what we are all about and what can we offer and how we can work together. It's a collaboration and partnership lah. Huh? Okay, let us do a brief about Health Performance Unit. Ken. Mala, just say next lah, next. So we are a unit first established known as Malaysian Health Performance Unit, MHPU lah. All right. It was a brainchild of our mantan DG lah. Okay, Tan Sri Datuk Sri Dr. Nori Sham. Way back in 2014, when he made a brief visit to Sweden and got to know about regarding performance. But we officially got our so-called birth certificate of establishment, our unit, only in 2019. And we were being parked in NIH. So I hope you all know the anatomy of NIH. NIH have 6 different institutes, but we are not under any of the institute. We are parked under Pejabat Pengurus. All right. So what's our job scope? Who are we report to? We park ourselves here, but we report directly to the DG's office lah. All right. So we report to the DG office, and the question is what we do. What we do is we are data vampires lah. We need data. So you give us a data, and if you develop a data, if you have data, most of your data are descriptive form. I don't know how many people understands about granulated data and aggregated data. All right. So most of the data which you present will be mostly in aggregated form. All right. But what we do is we call that as a descriptive analysis lah. It's analysis, but it's a descriptive analysis. All right. Of course, today, I think later you'll be knowing about some statistics workshop. But what I'm saying is we go very much deeper into, we look into, we do diagnostic level of the data. We look into the predictive, we do prescriptive, and we provide solution. So if you need some solution, not your marriage solution, if you need your working solution, come and approach us lah. We can work on it, on developing models, and we're developing a scenario where we can provide you solution. Whether you want to accept the solution or you don't want to accept the solution, it's okay. But we will provide for you the solutions. So in this kind of case, we are not doers lah. I would like to tell you a few things. There are people who are doers. Doers are people who needs SOP. You need ACTA, you follow rules and regulations. You have SOP, you follow the SOP. You have guidelines, you follow the guidelines. You have a paper description which give you a direction, you follow the directions. So we have about 90 to 95% in our KKM with about 330,000 human resource in KKM who are doers, who are in the field, who fight. There are quite a little who do management, who I can predict about doing management at the management level, at the JKN level, or at the KKM level. There are very few are creators. So sometimes a lot of people don't understand creators lah. So they will say we are a confusing people. So the doers always will feel creators or innovators are very confusing people. So we create and we are give it to you. So if you have data, provide us the data, then we will try to give you a solution. That's a very simple objective which we do. All right. So these are some of the projects which we do in HPU. We look into individual performance lah. What do you mean by individual performance? We learn to see whether you are a good in your what you say you are. If you claim that you are a specialist in certain field, we wanted to see, are you really or you just want the certificate to be hanged and declare and claim yourself that I am a specialist, or you want that you want my specialist allowance or specialist salary, that's because I have a degree. So we don't look into that. That is a credential part. You need a credential to be a specialist, agreed, but are you really skillful in doing it? So tell me, how many people now like me? Nobody likes me, right? Because you're worried that I'm going to look into your individual skills, individual performance, what you claim at your paper. So we look into it. So these are some of the things we look into clinicians, which including all the ED. We also look into healthcare administrator. Is the administrator is actually functioning well? And some of the things, other things we do is we do develop analytic, and we also help you to develop indicators. This is a very interesting topic because these indicators are very, very interesting to know. And also we do conduct on monitoring and evaluation. I need a big favor from the audience. I need you to unlearn some of these terms which I'm going to use, which you already had in your system. You've been learning this for many, many years. I want you all to unlearn just for half an hour. If you later after half an hour, you want to follow your own system, you're comfortable with it, well, or you wanted to feel that you wanted to follow my system, fine. But please unlearn yourself for a while lah. Okay. And number two, I need a volunteer lah. Is there any volunteer, preferable a trauma physician? Anyone can volunteer? I give you some time to volunteer yourself. Later I will call if whoever wants to volunteer. All right. Number three, who wants to join us in HPU? You can join us as a collaborator. You can join us as a partners, or you want to come to my unit and work also can lah. No problem. We are welcome. All right. Next. Okay. Let me give you a clear things what you have been doing so far for this past yesterday, today, and later and tomorrow. You need to have your mapping. What you're doing? You are looking into data. You are understanding your data. Number two, you have been learning the quality of data, right? You're learning quality of data. You're also learning how this data can be protected. Data protection, you've been learning. I hope you'll be listening lah. I'm just giving you a summarize what you've been doing. Then I wanted to see whether how is the cyber security. I think you understood about the data. So data quality, data protection, data cyber. Then you wanted to see how is the whole system going way forward of trauma system. Someone is going to give you an advice on how this way forward is all about. You're looking into scoring system. I think previously, you're looking into scoring. You're looking into audit, you're looking into integrity, ethical related on that. And after me, I think the authority is going to come and give you a talk. I'm the boss, listen to me. And the most important thing is, of course, you get some knowledge on research and statistical analysis. This is the entire process, entire flow you're going to learn yesterday, today, and tomorrow. Okay. So mine, please, again, I'm repeating, unlearn for a while. Hopefully you can unlearn lah. Next, please. Okay, I've been given a topic. I think the chairman has given a topic called measuring trauma system performance. I padam the measuring lah. All right, because performance itself is already a measuring. How you want me to measure? If I wanted to give a topic on measuring trauma system performance, it means you never had any system before. Improvisation. Let us talk about improvement of the system which you already have. You already formed. All right. So the process is improvisation. I would like to, next. What's the defining measuring performance? It's measuring and performance comes together. Why I'm telling you is, please take out whatever you learn about performance lah. What you understand performance and what I am telling you performance might be two different things. All right. We look into very evidence based. So it's defined as a regular measurement of outcomes. Why I'm saying here, the most important word here is outcomes. Okay, most of you has been looking into a lot of your indicators, right? Your KPIs lah, so-called your KPIs. And then you declare that indicator, the KPI you created is outcome based. Outcome for who? Is it outcome for you? Becoming very self-centric outcome? Or is it organizational outcome? You become a very self-centric on organization? Or is it a patient outcome? So if you take some of your indicators and show it to your superior, they say, be careful. Sasaran tu jaga-jaga lah, target tu. Boleh capai tak? Kalau capai letak, kalau tak capai jangan letak. That's a common thing, right? Jangan jeratkan diri. Bahaya nanti kat you. Nanti tangga gaji tak naik. So this is how a fear has been created all the while. And when we wanted to come and do some changes, we are known as the wrong person doing the right job. So you have to look into the outcomes and we want the results. End of the day, who are you working for? Some of you working for yourself. You uses the platform of KKM and you will use the entire facilities, entire medical things. We give it to you. And what do? You learn as much as possible, then you resign and you go outside. So some of you are working for yourself. Some of you are really working for the system. You want the system to be very perfect. How many of you sincerely working for patient? Sincerely working for patient. Every day thinking about patient, every day thinking of the patient you saw and you wanted to know what happened to this patient. Who I discharged, who I sent for admission. How many of you after you admit your patient from ED has gone back to the ward to see what happened to this patient? Or how many of you know what is the outcome of the patient, whoever you send to the bed? That's called true outcome, which is a patient-centric base. Is your indicator declaring that? And that's why we are coming into measuring true performance. I think now you're hating me more, right? Hopefully, I know. Don't worry. 99.9% of KKM people is hating us. It's okay. We are cool about it. Let us go next. Okay, measuring. What do we measure? Holistically, we measure the organization, which most of our indicators are there. Then some of our measuring process of organization, confining towards the objective, mission, vision. How many of you know your objectives? How many of you know your objective? How many of you remember the mission and vision of KKM? Can anyone raise up? Come on, guys. Why la? I'm not your enemy, guys. Anyone knows the objective of KKM? Anyone knows the objective of mission? Anyone knows the objective of vision or not? Come on, raise up. Come on, guys. You all talk so much and criticizing people. Whoever do good things, you all criticize. But come on, tell me who knows the mission, vision without Googling. Huh? All right. Measuring the individual performance. This is where behavioral science. This is where our KPK, mantan KPK and current KPK or DG. Some of you don't know what is KPK. Ketua Pengarah Kesihatan or DG, Director General, the mantan and the current, as asking us to look into your individual performance. Are you performing really well? And what is been assigned to my unit is to develop something which there are components, the dominants of the whole thing has to be there in a sense that to create and develop a new system so that never be biased. And that's our basic individual performance. But today, a topic given to me, today topic given to me on trauma system. Let us understand and we be in the same route on these terms. Because takut apa yang you belajar sebelum ni ataupun apa pemahaman you adakah sama dengan saya ataupun berlainan. Biar kita synchronize it dia. Objective must be very clear. Objective of your mission have to be very clear. As a trauma system, what is your objective? What is the objective you being a human? What is the objective of you being a son? What is the objective of you being a father? What is the objective of you being an husband? And what is the objective of you being a ED specialist? And what is the objective of being you subspecialty on trauma care? What is your objective? What is the objective of the system? What is the mission of the system? What is the vision of the system? You must know this by heart. If you don't know this by heart, then you are not being sincere to the system. You are being very self-centric. Very self-centric. Because you are fighting on comparing yourself with others, fighting this, fighting that, but you don't even understand the basic. Please understand the basic of the system. And definition of performance, very clear. My definition of performance must be very objectively. It has to be evidence-based, no subjective. Evidence-based. And this performance, if it's looking into the trauma system, it has to be patient-centric. Every time, two issues you bring it up. One, tak cukup orang. Number two, tak cukup barang. Tempat okey lagi lah. Kalau kita ribut taufan, habis lah. Tapi during COVID, tempat pun tak cukup. So tak cukup orang, tak cukup. None of you have thought about optimization. Why? Because this is not my house. I'm working for somebody paying my money. Who bothers? Who cares? So I look into that frame. So to develop that, you need a framework. What framework it is? Framework is misused. Framework is a clear picture. How are you going to do performance? And it has to be objective oriented. It has to be vision oriented. It has to have a vision oriented. If you don't have in the framework, it's not clear. Monitoring is very important. Don't over monitor and don't under monitor. And finally, my unit basically will provide you a benchmarking, evidence-based benchmarking to your level, not to what I want. Because I'm not the subject matter expert. Remember this, I'm not the subject matter. You are the subject matter expert. You are in the field. To benchmark you, you will be the correct person. Not I come and tell you, oh, this is A, this is B, you must follow. No, I don't do that. I allow you to decide what is benchmarking for yourself. Evaluation has to be real time and it's ongoing. Oh, it's difficult. I find it so difficult for many years. to do this because the theory of change, there's a word called theory of change. If you have time, read about theory of change. It's a big thing. Next. Prerequisite to measure performance in trauma system. That's how the chairman has given me the topic. Make sure you know your objective, mission, vision well. Next. Okay, now I need a volunteer. Because as I mentioned, I need subject matter expert. Is there any volunteer? Come on, guys. Any trauma physician? I'm not going to kill you. Come. Guys, any trauma physician? Any volunteers? Dr. Sajahan, you must give me one volunteer. Come. So we got one, not volunteer, forced volunteer. The way he walks, he knows I'm given. Okay, while he's coming, why I wanted, because I want you to be very clear. What's my function and what's your function? My function is I'm not subject matter expert. I'm not your trauma physician and I know nothing about trauma. Okay, come, doc. Your doctor? Dr. Ibrahim will be my volunteer today. Okay, come, doc. Let us share the mic together and then we see. Next, please. Okay, let us develop. You all must learn how to develop. I told you all, please unlearn. Please unlearn. Doc, what is the objective of trauma system? Don't copy, yours.
Trauma system. To ensure delivery of
You're the main man.
optimum trauma care in order to improve the outcome of trauma patients.
Objective must be very clear, guys. Objective must be very, very clear. Because you know why? If you don't have a clear objective, then I will find a bit difficult to develop a framework for you. Wrong, never mind. But objective must be clear. I just given an example to provide care to trauma patients. Just a simple. Of course, doctor has given elaboration a bit more. Okay, we'll follow. We'll follow the objective. It's okay. No worries. There's nothing right and wrong here. All right. Let us look into the vision. What is your vision? What do you wanted to see? Trauma. In 5 years' time, in 10 years' time.
Development of an established and system, established trauma system, which is sustainable for which is self-sustainable.
Okay. So he's looking into vision and he has mixed in with the vision. Okay, because he has a mission and vision. But what I've written here is more into patient-centric. Because I'm focusing my vision to what I can provide to patient. Because my objective is looking into very patient. But can you compare his objectives? It looks more into system. Understand what I mean? Nothing right and nothing wrong. I just wanted you to learn the differences. This is where we come in to help you out. This is where we come here to give you an advice how we can look into it. Why? Because we look into the main KKM punya objective, mission, vision. We are formed a KKM to treat people, right? But if not, we change Ministry of Health to Ministry of Disease lah. Kita tukar. Because you don't want to look into the health of an individual. So I look into patient. You look into the system. You understand? So his mission, vision is check up. You know what? He wants sustainable system. Because you know why? He's creating a system. He's fighting to create a system. So automatically the system can benefit the patient. So he's fighting for the system. But now I'm fighting for the patient. So how we can come into equilibrium? So we have to put it. So your objective, mission, vision of the system must be very clear. Next. Are you okay? Huh?
Yeah, okay.
I'm not bullying you. Huh?
It's like Viva.
Okay.
You're Vivaing me.
Looking for your PhD.
It's okay, you can.
So prerequisite for definition. What is the trauma system prerequisite? If you look into this, the system, very clear. Means an organized approach. We post-mortem every definition, not just blindly take. If not, I cannot work with you. So we look into organized approach to provide care to the trauma patients that provides personnel. The system which Dr. Ibrahim mentioned is basically looking into the personnels, looking into the facilities, looking into the equipments, because he wants it to be effective and coordinated well. So we wanted to put all this. Why we are picking up all these words? These are the words which will create the indicators. If not, I cannot monitor. Next. Look at the trauma system performance model. I want Dr. Ibrahim to create a framework. But Dr. Ibrahim said, I'm not an expert in that. I'm a trauma expert. Why are you asking me to do management job? I'm a clinician. Why are you torturing with me management job? Fine, doc, no problem, doc. So Dr. Ibrahim, you just tell me, do you have a proper SOP? Do you have a working flow? Do you have a strategy plans? Because while I was standing at the back, Dr. Sajjan, everybody is looking into planning this strategy plan, workflow. Is that workflow is correct? Hey, no. Okay. So you look into the strategy plan and you see what are the references. If you have all this, then we can establish a framework. Because the next step, we have to look into the indicators. The indicators have to be clear. It has to be input. It has to be process. It has to be output. It has to be outcome. And it has to be impactful indicators. For whom? For patient. Going back, whether you're looking for organization, whether you're looking for your department, or you're looking for your patient. Very clear. So evaluation, the only thing I can see is your data. Your national trauma database. Is that enough data for you to develop this? Or you need to collect more data? So how you analyze this data and improvisation data? Don't worry, all this we can do. We can do. But you have to give me a data. And what we can deliver to you, what the system can deliver to you, basically, it has to deliver your real time. Doc, you need a real time, right? Information. He needs a real time information. He needs a real time information for what? To make decision. Because he is already focused. Patient, no problem, doc. I can. But I need information. I need a real time information with the data so that I can make decision faster and for a betterment of the patient. Do you have indicators for that? Tada. So the dashboard which you're creating must have a decision-making capacity. Do you think Dr. Ibrahim's IQ and your IQ is same or different? Definitely different, right? Not everybody has the same IQ, right? But same, everyone is focusing to the same objective, same mission, same vision, looking into the patient-centric, but you don't want to have a teamwork. Dr. Ibrahim doesn't like me. He doesn't want to work with me. And I don't want to work with Dr. Ibrahim because I don't like him.
You can read my mind.
Yeah. Thanks. So, I know, at least we are having some fun. So, you don't want to work. So, if you don't want to work, how do the whole system works? So, we have to work together. That's where the team player coming in. So, we always look into the strength of the people and execute the strength. But the problem with everybody is 99.9% always happy with the weaknesses. And you all want to see the weaknesses so that you feel superior. I think that you need to meet up a psychological counselor. Huh? Next. Okay, this is a framework. An example of a framework I can show you for the trauma. Yeah. Patient-centered trauma care. Patient-centered trauma care. How you can actually compile it. I might be wrong. Dr. Ibrahim said, no, doc, you are wrong. Agree? come, let us work together and develop a framework. Because I know how to do framework and you know how to do the material. You are a subject matter expert. I cannot just take this and give it to you. Oh, Dr. Ibrahim, you just need to follow this. I'm the person who are in charge. You follow. I can't do that. I can develop the framework, but the material inside, the subject must be given to me. Then I can develop for you the matrix. The matrix which include input indicators, your process indicators, your output indicators, your outcome indicators, and impactful indicators for your mission, vision, and objective. Then the indicators are very clear. You're very clear. You can do very perfect. And then Dr. Ibrahim said, "Doc, I want this, I want this, I want this." Fine, I will give it to you. No problem. Next. Implementation process is very important because Dr. Ibrahim is heading a trauma center. He's heading a trauma center. Don't you think he wants to monitor what's happening at the downline? Are you perfectly doing? Or you are expecting him to knock his head every time, thinking? Can't. So the process will be there. Input always very simple. Remember, input 4 M's. You need to have manpower, you need to have materials, you need to have methods, and you need to have machines. Then we can work out on the processes. Sorry lah, 30 minit memang tak cukup. This one will take 3 days. All right. So we can look into developing indicators for each session so that the matrix will be very clear. Okay, next. Improvisation. This is very most important because if Dr. Ibrahim doesn't get all these things, how you expect him to do improvisation? He cannot. Because he is the subject matter expert, end of the day, he is the best person to do the evaluation. If you want to understand how to do evaluation, of course we can guide you. We are here to guide you and help you. What we are saying is utilize us lah. Thank you, Doc.
You're welcome.
I think that's all right. Yeah. So we will be back if you wanted to see us, just to share with you that we are basically some sort of training, some sort of monitoring evaluation training we do. If anyone interested, please come and join us. And we are also doing a project with Dr. Shahjahan. I think we are developing some model with Dr. Kamarul from IMR. And we are working on it, how to benefit. But remember one thing, it is all patient-centric. Okay. Thank you so much.